So, as we're talking about these interventions, I know we touched briefly on communicating with your provider. I think one of the things I like to cover here is called the BRAIN acronym. Now, BRAIN is like if you just think, I just need to use my brain when it comes to knowing what to do about these interventions. So, B stands for benefits, understanding from your doctor in terms you can understand is something that's really vital to communicate to them through the pregnancy process, right? Through all your prenatal appointments. So you ask them, what are the benefits of doing this thing? R stands for risks. What are the risks that come with doing this induction or breaking my bag of water? What are the alternatives? What are my other choices? What does my intuition say? Now, this is really important because a lot of people in our society are like, intuition, who needs intuition, right? Like we totally dismiss it. But it's really an important part of parenting. Your intuition is going to be one of your best friends throughout this process. You need to learn to trust it. So check with yourself. What do I feel in my gut about this situation or this intervention? And then N stands for needs time or not now. It's not a problem almost always to say, I need a little bit of time to talk with my spouse about this, or I need a little bit of time to think about that. Or even to say something like, not now, I'm not interested in a cervical sweep right now. I'm just not interested, but I might check back with you next week or something like that. So don't feel afraid to say no. One of the things that you can do, I highly encourage people to do this, is when a doctor is talking to you about stuff that they think they want to do to you or for you, you can ask them, is this an emergency? Do I need to make a decision right this minute, or do I have some time to talk about it? When you ask that question, it really helps you understand the circumstances that are going on, because honestly, you're taking the classes here and you're gaining as much knowledge as you can, but it's impossible for you to know everything. I'm a labor and delivery nurse and I've been in this field for 20 years and I don't know everything. I'm constantly learning. And so asking them if it's an emergency and if you have time to have a conversation and think about it helps you understand that this isn't a dire situation that you need to do this right now.